Good afternoon, folks. Today's topic A discusses family caregivers and healthcare professionals so often miss opportunities to collaborate. Okay, so that's what we're discussing today for A. So please join me in the presentation I made for you. Sit back and enjoy, please. Okay, here we go. The article describes a quantitative study exploring why family caregivers and healthcare professionals so often miss opportunities to collaborate during end of life care and how those gaps later shape grief, regrets, and emotional burden. Drawing on interviews with bereaved adults and clinicians, the researchers found that the most painful regrets weren't only about medical decisions, they were about moments when communication faltered, roles were unclear, or caregivers felt unprepared for what was to come, what was coming. These missed connections created a ripple effect: uncertainty during care, self-blame afterward, and a sense that the experience could have been gentler if collaboration had been more intentional. Key findings and what they mean. Caregivers carry long-lasting regret tied to unclear communication. Many interviewees described moments when they didn't understand the prognosis, didn't know what questions to ask, or felt they should have acted differently. These regrets were often rooted in missed opportunities to shared understanding rather than in the medical outcome itself. Coordination challenges, not lack of compassion, were the main barriers. Clinicians and caregivers often wanted the same things: comfort, clarity, dignity, but fragmented communication, rushed encounters, and unspoken assumptions assumptions prevented true partnership. Collaboration is a skill, not an instinct. The study suggests that both families and clinicians benefit when collaboration is treated as a deliberate practice, something supported by structure, tools, and training rather than left to chance. Better collaboration reduces bereavement burden. When caregivers feel informed, included, and supported, they're less likely to experience self-blame or unsolved questions after the death. overlooked collaborative opportunities, expanded examples. These are the kinds of moments the study suggests are routinely missed, but could transform the experience if handled intentionally. Early anticipatory conversations about the likely course of decline. Families often don't know what the next weeks or next days might look like. Clinicians who map out scenarios help caregivers prepare emotionally and practically shared decision maker, shared decisions, shared decision checkpoints. Instead of one big conversation, families benefit from brief, repeated check-ins where clinicians ask, does this still align with your goals, or what worries you most right now? Explicit role clarifying. Caregivers often don't know what they're responsible for. Symptom monitoring, medication timing, calling hospice, managing paperwork, naming roles reduces confusion and guilt. Emotional validation as part of care. Caregivers frequently suppress their own distress when clinicians normalize fear, uncertainty, and anticipatory grief. Families feel safer asking questions and making decisions. Post event or post death debriefs, even a brief conversation. Here's what happened, here's why, and here's what you did well, can dramatically reduce self blame and lingering doubts. Implications for caregivers, clinicians, and systems. For caregivers, asking for plain language, explanations, and written summaries can prevent misunderstandings. Requesting regular check-ins helps ensure decisions stay aligned with evolving goals. Naming your own emotional needs. I'm afraid I'll miss something important. Invites clinicians to support you more fully. For clinicians, structured collaboration, family meetings, checklists, clear handoffs reduces the emotional load on families and improves trust. Recognizing caregivers as part of the care team, not just observers, improves decision quality and preparedness. Small gestures, sitting down, pausing, acknowledging uncertainty, having outsized impact on caregiver confidence for health systems. Embedding collaboration into workflows, e.g., mandatory family goal documentation, prevents it from depending on individual clinician style, training programs that teach communication, anticipatory guidance, and emotional validation can reduce long-term caregiver distress. Digital tools and track goals, decisions, and symptom changes can help families and clinicians stay aligned. Practical next steps to apply the findings. Schedule at least one structured family meeting whenever prognosis changes or a major decision is approaching. Provide a written summary after each major conversation so families can revisit information when overwhelmed. Build a simple prompt into rounds or home visits. Have we checked in with the family about their understanding and goals this week? Encourage caregivers to keep a question log so concerns don't get lost in the chaos of daily care. Use brief anticipatory guidance scripts. What to expect in the next 24 to 48 hours to reduce fear and uncertainty. Takeaway. The study shows that the most meaningful improvements in end of life care don't require new technology or more resources. They require intentional, structured collaboration between clinicians and family caregivers. When communication is clear, roles are defined, and decisions are shared, families experience less regrets, less self-blame, and more human end of life humane end of life journey. Okay. Next part of this, guys, talks about the way geriatrics handles end of life and things. All right, so here we go with the geriatrics side of things. Through our geriatrics and palliative medicine program, an interdisciplinary team of geriatricians and other specialists from Columbia and Wheel Cornell Medicine work to evaluate quality of life for the patients. Our services encompass geriatric primary and emergency care, a major collaboration on on older on elder abuse and neglect, and compassionate management of end of life care. Okay, guys, so that is your A. I will be back on shortly with B. Give me a little bit for a break, and I'll be back on with B for you. For now, Gator Wellness, take care, folks.